right, good morning and thank you for keeping it Citizen Television. It's actually 8:11. We're still in that time where people are waking up, and this is the time where one of the things that you're going to be talking about is very essential, that is taking care of your dental health. Part of it is actually brushing your teeth. There are times that are recommended that you're supposed to brush your teeth, the basics. Do you know? There's also the proper, advisable way. You could be brushing your teeth actually very regularly and you're committed, but you're doing it the wrong way. We will talk about that. And also, we are also going to be telling you about some of the most common, diseases that affect I would call it oral health. So I have with me Daktari in studio, Dr. Naftali Macharia. He's a dental implant surgeon. We really appreciate your company, but we'd like to hear more about you, so probably just to give you a chance to do that as well.
Good morning, Safin. My name is Dr. Macharia Naftali. I'm a dental implant surgeon and a general practitioner as well. I co-founded and co-run a clinic with one of my best friends called Dr. Johnston. It's called the Dental Spa. That's where we do our practice. Yeah, so I'm here to teach the public a thing or two about oral health, and I'm so honored for this event.
All right.
Yeah.
Karibu sana.
Yeah.
I didn't know there was a spa that takes care of
Ours is.
Thought spa is just about beauty and aesthetics, but it turns out there's a spa for dental issues.
Dental, yes.
All right, so you have something very interesting for us this particular morning. I just run us through what. Let me begin from the very basic. Why is it important for us to really pay attention to our oral health? Why is that such a big issue?
We usually say that the mouth is the window of the body or the door of the body. So everything inside your body starts with your mouth. If you want to eat, you'll eat with your mouth. Your confidence comes from being able to speak to people, to look good, to look nice, So it's important to take care of your teeth, to take care of your oral health, because the mouth is really, really important to your body. Again, when you're an adult, when you lose teeth, they do not grow back again, compared to kids who, when they lose their milk teeth, they grow again. So this is one tissue that you need to really take good care of.
So how exactly do you do that? And let's start with the very basic. One of the questions that I said I'll ask you when we begin this conversation is, when are we supposed to brush our teeth? Some say you wake up, you brush, that's it until the next day. When you wake up, you brush, that's it again. It's a very common thing for many people. But what is recommended?
So I usually tell all my patients, and everywhere I go I preach this, it's called a rule of twos. You're supposed to brush twice every day for at least 2 minutes, in the morning and in the evening, after meals. There's this controversy going on around, people saying you should brush before your meals, but it should be after meals, in the morning and in the evening for at least 2 minutes. And how do you do this? So I usually say, because people don't time themselves. Most people just go in with their toothbrush, 1 minute you're done and you're running to work.
As a formality.
As a formality, So it should be 2 minutes. 2 minutes is long enough for you to do a good job to remove all the plaque. This plaque is what will end up causing cavities and gum disease and other oral health diseases, So it's good to brush twice every day, in the morning and in the evening, after meals, for at least 2 minutes.
For at least 2 minutes.
Yes.
The later in the day one is kind of makes sense after you eat, but the morning one, for some people feel it should be before breakfast, because of course you're trying to get rid of the bacteria and the bad breath and all that, so that by the time you're having breakfast, you're having breakfast when you're fresh.
Yes.
Yeah. So demystify that line of thought for us. Yeah.
Okay. So one of the most common dental diseases is called dental caries or cavities. And cavities, in school we define it as a multifactorial microbial disease. That means that there are so many things that cause you to get cavities. And the most common one is sugar. And in almost every single meal that you take, there is sugar. And when that sugar stays in the mouth for a prolonged period of time, it is broken down by the bacteria in the mouth. It releases an acid that breaks down in your tooth and then causes you to get a cavity. So if you have breakfast and you've taken bread, which has sugar, or you've taken Weetabix or something that has sugar, you'll end up, if you brushed before, so you'll have to now spend the rest of the day with sugar in your mouth. You understand? So it's good to eat first, then you brush this sugar away so that it does not get acted on by the bacteria, so that you don't get to end up with cavities.
All right. So let me take you back to where this problem starts. So how do you end up getting bad breath when you wake up in the morning? Where is it coming from? Because the reason people brush before breakfast is because of the discomfort immediately you wake up. So where does it begin?
So now in the mouth, you form something called plaque. Okay, this plaque is now acted on by bacteria, and these bacteria release sulfur-like gases that give you bad breath. Yeah, that's why when you wake up in the morning, you feel like you have bad breath. It's plaque that was formed throughout the night when you are not active, when you are just asleep. Because even when you brush, you don't remove everything in the mouth. The bacteria in the mouth also remains. So some of the plaque that also remained tend to give you morning breath. Yes.
All right. So it is also advisable that you should brush your teeth before you go to bed.
Yes.
Yeah. So that to reduce that impact. So how do you the recommended way? We think we know. At least now for CBC. They are taught how to do it. And the teachers are so deliberate about it.
Yes.
And back in my time, that was not even something you were taught in school. So we assumed we know. We see people do it, we do it. But then how do you brush your teeth? And you can even talk to us about the choice of the toothbrush and the toothpaste, because that I also hear can be a cause of your problems.
Yes, that can be a cause of your problems. So normally, most people, first of all, you need to change your toothbrush every 3 months.
Every 3 months.
Every 3 months, okay. And then the toothbrush, these things are called bristles, okay? There are different types of bristles. There are the soft ones, the medium, and the hard ones. Mostly for the soft ones, it's for people with with gum disease, yeah? And they need the bristles not to be too harsh on the gum, yeah? The medium is for probably everyone, most common, the normal, yeah? That's what I use, that's probably you should use. And the hard one sometimes is I usually recommend it for people who smoke a lot, because they tend to stain their teeth. So the bristles will tend to clean that soot off, yeah? So you start with your toothbrush, new toothbrush every 3 months, 2 to 3 months, okay? Then...
those people who stay with toothbrush for a whole year or two, mpaka imejikunja hivi, mpaka inaka.
Exactly, imetokana kabisa. You should not please change your toothbrush today. So, brushing, then you start. So, most people brush. You can even hear the sound, yeah? Someone can literally wake you up in the morning. Someone can literally wake you up in the morning. So, what you should do gentle round circular motion. Gentle round circular motion. 3 to 4 teeth at a go. You move everywhere, very gently. That's why you'll take around 2 to 2.5 minutes, yeah? So everywhere you do round circular motion. Because if you do this and up and down, you're going to cause your gum to recede. It will move down, yeah? And then you'll abrade your tooth.
And this is progressive. It doesn't recede in a day. Yeah.
Exactly, wear and tear. So if you do this over years and months, you'll definitely start, and you're using a hard bristles, you'll definitely start to see those effects. And then you'll start to expose the root part of your tooth. And then you'll start to feel sensitive,
yeah. Okay.
You take something hot or cold.
Yeah, true.
Exactly, yeah. So you should do round circular motion, 3 to 4 teeth at a go. On top of the teeth of your teeth, you can now do this, yeah. And then on these surfaces here, on the inside, you can do vertical strokes like that, and on this side as well. Remember to also brush your tongue. People forget that all the time. It is really important to brush your tongue. Another thing, once every day before you brush, in the evening probably, because maybe in the morning you don't have time, you should floss in between. Yeah, because most of the cavities, food packs in between your teeth, and the bristles on your toothbrush are not able to access there. So you go in with your floss, you floss everywhere, you remove all the debris, then you brush, and then afterwards you can use a mouthwash. Your toothpaste.
There's a question about brushing your tongue. Yeah, whether that's a thing.
Yeah, so now if you don't want to brush your tongue, there's something called a tongue scraper. Yeah, you just now scrape your tongue. Yeah, but you should.
You should brush your tongue.
You can even say clean your
tongue.
Yeah, either with the brush.
Actually, it's important. You remember with young babies, one of the things you're advised is you clean their tongue regularly. Exactly. There's a way this salty water. So there's a reason why you should sustain that habit over time. You could brush your teeth very well, but you still wonder, why am I still having bad breath?
Yeah.
Why am I still feeling like I'm not fresh? It's because probably you have not, like brushed your tongue. The choice of the product to use, toothpaste.
Yes.
People just go for anything, including soap or salt or, I mean, whatever it is that can in as a form, the foam. People think that's okay. As long as there is foam, you can be able to brush your teeth.
Yeah.
But talk to us about what product to use, what is recommended.
Toothpaste, So in toothpaste, there are two very important components of toothpaste. The abrasives, this is what will now remove the plaque. You understand? Something that will come in, remove the plaque. And fluoride. Okay? Fluoride is important for your teeth because it helps to strengthen your teeth. It helps to prevent cavities because you'll find that it forms a layer on top of your tooth. It reacts with your tooth and forms a layer that will now prevent. Remember the bacteria and the acid that is being broken down from sugar that causes the tooth to get a cavity. So fluoride forms a layer on top to prevent that. So that's why it's important to have a toothpaste that has fluoride, the abrasives. So those are the two most important things in a toothpaste. So you should use fluoridated toothpaste. Without fear of contradiction, I can say that.
All right. Salt, soap?
No.
Those who use sticks and with nothing in
the stick is actually one of the best
setup.
The stick, actually, one of our profs in school used to say that the stick is so effective. So you can use the stick. People use the stick, but no one is going to use the stick in this time and age, unless we're back in the village. The stick is good, but toothpaste and a toothbrush, that's the standard.
So salt and soap doesn't really help?
No.
All right.
Yeah.
So let's talk about, you run a dental spa.
Yes.
So I assume one of the things that you interact with on a regular basis is, people coming with different forms of issues that they have with their dental or oral health.
Yes,
But before we get to those who come with issues, do you just get people who really come for the normal checkups and the regular, or are Kenyans coming when it's too late and they have, talk to us about the trends you're observing with regards to even the level of awareness and what people know and their habits out there. What does the traffic tell you?
Look like now, So I'll tell you, I've practiced for half a decade now. So maybe in the first 2-3 years, what I used to see was people used to come in very, very late. They have a tooth with a huge cavity. It has a swelling. The swelling has pus inside. It's chaos. You're trying to put anesthesia to remove that tooth, do a root canal for it. Anesthesia does not work because of the abscess. So you find that people used to come really, really late. People used to fear the dentist, one, because in the back days, the dentist used to be they used to traumatize people a lot. They used to be very rough. So people now carry that with them. You remember even in school, kids are told, "Ndakupeleka kwa dentist akung'oe meno."
Actually, that was the only thing people think they used to do.
Exactly. That was
kung'oa meno ndio kazi yao.
Exactly.
So kama utaki, you won't go.
Exactly. That was the threat. So now people used to fear coming to the dentist a lot. But now the trends have changed because of social media, because people are well aware of their health, because wellness has become a thing now. So we are finding that people are actually coming for their regular checkup. Someone will actually book their appointment for every 6 months by annual. It's not so good yet, but you can see the change in that. But still, most people still come with problems.
Because of a problem.
Pain,
Let's talk about these problems. There are so many, that cut across, but what are some of the most concerning ones that when you interact with patients, you realize, there is need for more knowledge, more awareness to avert some of these problems? Just run us through the most common, oral health diseases that people are battling with in our country.
Correct, So the number one most common dental disease is called dental cavities or dental caries. It's actually even one of the most common non-communicable disease in the world. Like almost everyone has a cavity, A lot of people have cavities. Number two is called gum disease, periodontal disease. Those are a disease that involve the gum, the bone, and the roots of the tooth, and the ligament that supports the tooth to the bone. Number 3, it's coming up now. It's called dental fluorosis. I know you've seen people with brown teeth, or you've heard of people with brown teeth, especially people who grew up in a place like Naivasha, Nakuru, Eastern Province, in the Northern Province. Yeah, they get something called fluorosis.
And Nyando, those sides.
Exactly, where there is high fluoride levels in water. Exactly. So that is very, very common. It's not becoming so common in Nairobi as well, because as you can see, everywhere you walk, there are apartments going up, high density cluster population areas. So you build an apartment 10 floors up, where you get in the water, you have to go for a borehole.
Borehole water.
Borehole water. Is this borehole water treated? Most people do not follow up on that. So you find that there's a lot of fluoride in the water. So you find that kids are getting really affected. They're getting fluorosis a lot. Another common one is trauma, dental trauma, contact sport, kids playing in school. You find that you get your teeth, they break a lot, yeah? Accidents as well, because we have a lot of road traffic accidents from motorcycles, from cars. So you find a lot of dental trauma. You break your teeth, you break your jaws. Another more common one that's also is becoming very common is oral cancer, dental cancers, mostly due to people who are predisposed, people who smoke a lot, and people who take a lot of alcohol. Yeah. So those are the ones that I would say are the most common. Yeah.
I'm really pushed to ask you this question. When you say people who drink a lot, what do you mean by a lot?
more than the general doctors recommend. More than what is recommended.
Should I say the drinkers nation has spoken? Anyway,
yes.
Let's get back to the cavities, because this is very common.
Yes.
Is it like, what is the most common cause?
Yeah.
Is it related to lifestyle? Is it something, like, just run us through what is the most common cause?
Cause of cavities, yeah. So when you were talking earlier on, I told you how we define it at school. It's a multifactorial microbial disease. Multifactorial means a lot of things.
Yeah.
Microbial means bacteria and all these things. So what happens, how do you get a cavity? It starts with sugar, diet, lifestyle, what you eat. So a lot of people take high cariogenic food. You're always taking food that has a lot of sugar. You're always snacking in between. In between your show, you snack, yeah? So what you do is that this sugar is broken down by the bacteria in the mouth, because you have what you call normal flora in the mouth. So this bacteria acts on the sugar that is on your teeth, yeah? It breaks it down, releases an acid. This acid is strong because your tooth, the outer layer of your tooth is mineralized. It acts on that mineralized layer and breaks it down. So when you break down the outer layer, that's when you start to get a cavity. So diet is the first, highly cariogenic sugar. People take a lot of sugar. So that's the first one. And then number 2 is called time. You need time to form a cavity. A cavity doesn't form just in the morning or in the evening. It's over a period of time. And how does this happen? Again, the frequency of taking sugar. You see now when you brush in the morning, you have breakfast, you brush. So in between the day, if you snack a lot, you're also increasing the amount of sugar that's remaining on your teeth. And that's how you end up getting a lot of cavities. So snacking is really advised against a lot. Reduce the amount of sugar, and then you brush, because you need to clean all these things away. Yeah.
One thing I interacted with is that when it comes to these diseases, it's sort of like gradual. It starts somewhere, and then the more it remains unaddressed, it
becomes worse.
Yeah. So I wanted to address people who think that, okay, I feel a little pain here or a little discomfort here, but it's nothing serious.
Exactly.
I mean, I can still handle it. So let me just, wait it out. Nasikia tu meno inaniuma mahali kidogo, but ni sawa. It will go away. Is that dangerous?
That is so dangerous, yeah. So you know what happens? As I was telling you about flossing and cavities starting in between teeth, yeah? And why you should floss every day. So most of the time, most cavities start in between your teeth. You will not be able to see it when you're brushing, you check into the mirror, you cannot see. But in between your teeth, cavities are forming there.
But probably you can show us, like, with
so
where exactly they start from.
Yeah, you see this, okay, that one? Yeah, this contact area here, inside here. So food usually gets there. because there is a space there. So food gets in between there. And then it starts to spread inside and across like that.
I think that's your camera.
That one? So it starts to spread inside like that and like that. So eventually, because inside has broken, you have a shell on top. So when you bite, it curves in. And that's not the day it starts to hurt you so much. You start calling off in the morning, hey, daktari, 4 a.m., meno,
Na meno kuja tu usiku.
Exactly. Can I come to the clinic at 6 a.m.? At 6 a.m. we are still sleeping. So that's what usually happens. So that's why it's important to floss in between. So when you start to feel sensitivity, mild sensitivity here and there, you're starting, when you bite on something, you feel something. You go to the dentist at that point. We will take x-rays and then we'll confirm, is there a cavity that has started in between? Is there a cavity on top? And then at this point, the treatment is just a simple feeling, no pain. You don't have to come again for to work on that tooth. But then when you wait, the tooth really breaks down totally. And then you start to you have to undergo something called root canal treatment, or you have to get your tooth removed. You are in too much pain. Yeah.
Let's talk about the gums.
The gum, yeah.
Their significance.
Yeah.
And also sometimes we ignore them.
A lot.
Yeah?
Yeah.
I mean, who thinks about the gums?
Who thinks about the gum? That's true. Yeah.
You only care about your teeth. And if you're too careful or concerned, you'd take care of your tongue. But who thinks about the gum? I mean, we just think it's like sort of like the skeleton of the body. The way we never even think about it. It's there to hold things together. So the gum, we think, it's just there to hold the teeth together. But how significant is it? And do we have also complications that arise with the gums, and how common are they?
Yeah. See, there's the word you used, hold there. So the gum, there's a unit around the tooth. It's called the periodontium. That means the gum that's around your tooth, the bone, which is holding your tooth, and the root that is inside the bone, yeah? So that's the periodontium. It holds your tooth. So when the gum gets disease, yeah, that disease spreads to the bone that's holding your tooth inside, yeah? And then you start to lose your bone. It's called resorption, okay? You start to lose your bone. When you lose your bone, you're losing the support to the tooth. And that's why you find that your teeth start becoming mobile and weak. It's so common up country. You find your grandmother has teeth that have migrated. They look like they're in front, some are everywhere. And if you try to remember, she has not always been like that. That's the progression of gum disease.
Oh, okay.
It starts like that. So you find that the gum becomes infected, it swells, it bleeds. Whenever you're brushing, you have bleeding gums. That's the first sign that you have a gum disease.
So your gums should not bleed at all?
They should not. They should not, yeah? Yeah, at all. So when you start to see that you have bleeding gums, please go to the dentist. Probably not gotten your teeth cleaned in the last 6 months, which should be followed religiously. You should have your teeth cleaned biannually so that you avoid getting gum disease, okay?
I want that to come out clearly because, say, your teeth should be cleaned.
Yes.
But then we think that we clean it every day. So what is this cleaning that you're talking about?
What is this cleaning that you're talking about? Yeah.
And why is it recommended?
Yeah. So, what you do when let's say when you wake up in the morning, we're talking about having, you don't feel like your mouth is fresh. You feel like you have a layer of some salt, sand, something. There's just a layer on top of your teeth that does not feel so nice. That's called plaque or tartar. Over a period of time, when you brush, you remove it, but you don't remove all of it. Yeah? Some of it remains and accumulates, especially around the gum line here. Okay?
Is it like the creamy...
Exactly.
Yeah?
So now
substance
that
doesn't go away no matter how hard you brush.
Exactly. So that tartar now hardens and becomes something called calculus. That's that creamy, brownish color that you see. You try to clean it out, it does not come. One day maybe something chips off and it's very, very hard. That's called calculus. It harbors like really nasty bacteria. The ones that now start to eat your gum and your bone. Those are the ones that cause your gum to now start to recede. Okay? Your gum is now moving away from where it should be, exposing the root of the tooth, the bone. And then now, these bacteria that it harbors start to eat your bone, and the bone starts to resorb as well and goes down. So you start getting, your root is exposed, sensitivity. There's no good support for your teeth, it starts shaking. So that's the
then you may lose a tooth or two.
Yes, then you end up losing a tooth or two.
If you are an adult,
You cannot.
You don't get it again.
It does not grow back unless now you start to replace it.
So this cleaning is done by a professional?
Yes. So this cleaning is now, that creamy white thing that we're talking about is the one that you need to clean every 6 months now, because you're not able to clean that out with your toothbrush. Yes.
So how do you clean it? Do you numb?
No.
Is it painful because it's almost around the gum area, which is very sensitive?
If it's too much and it has seeped into inside the gum, we usually numb that. At that point, you have something called like moderate to severe gum disease, and so you need to numb and clean inside the gum as well. But regular cleaning, you don't need to get anesthesia for it. You just clean. Use a machine called an ultrasonic scaler. So what it does, it vibrates so fast. It's pointed, vibrates so fast. When you touch the area, it knocks it off. So that's what we call regular cleaning at the dentist. You see, your toothbrush cannot do that. Yeah.
Also, there is one thing you need to underscore, in as much as you are very committed in brushing your teeth regularly and as recommended 3 times a day. Is it three maximum?
3 maximum, yeah, but 2 is more than enough. 2
is more than enough.
Yeah.
As much as you do that, there is also need for you to regularly, after 6 months, you go for the professional cleaning at the dentist.
Exactly.
Yeah? That is also recommended.
Twice every year.
Twice every year.
Yeah, so I usually say I have a rule of to brush twice a day for at least 2 minutes and visit the dentist twice every year. Yeah.
Okay.
Yeah.
So when was the last time you went to the dentist to just clean your teeth? Ask yourself that. There's one viewer called Reverend Norman Naguko saying, "Morning, Safina, I do brush 3 times a day. Could this affect my gums?"
Not really. Not really. How you brush also matters. If you're doing the round circular motion, firm but gently, it should not affect your gums at all. 3 is okay. Is it too much? No, neither here nor there. 2 times is more than enough.
All right, depending on what you prefer.
Depending on what you prefer, exactly.
So how do you take care of the gum area, when you're brushing and even just regularly, so that you don't develop the sensitive, tooth, the diseases. There are some people who have black, it's turned black. Does that mean that it has a problem?
No, most of the times, so the gum has different colors. We are all pigmented in different ways, So there are people who just have like really, really pink gums, like your coat, And then there are people who have maybe it's red gums, not too red, because too red is now
a problem.
And then there are people who have like black spots. It's just melanin deposits on your gum. Smokers as well, sometimes they have like, you can see their tongue changes, or they have like really black gums, but that's because of that. But even if you have black gums, you should not really worry about it, especially if you've had it all your life. It's just how your gum is pigmented.
So there's no cause for alarm if you have black gums.
If you've been having that for a long period of time, you should not be alarmed at all.
Other than brushing in a way that is not recommended, is there anything that would cause your gums to recede?
Normally it's just the brushing and the gum disease. That's what causes that to recede.
All right.
Yeah.
Let's talk about the color of the teeth. It's supposed to be white.
Yes, white. Not
Do we have
white.
cream? Let's talk about cream. Yeah. Okay, off-white. And brown. Brown, which is a condition that I want you to talk to us about. So, so the off-white. Is it okay?
It's okay. Yeah. So teeth are not usually white.
There are people who have white.
Yes, there's
nowadays people are actually going for
cosmetic work.
For cosmetic work to be done, so that the people have white teeth. You're wondering, when were you created? Anyway,
not to time with you. Yeah. So now some people really have white teeth. You'll find there are not so many natural white teeth without getting cosmetic work done, So some people have white teeth. Not so white like milk or clouds, But even that deviation from white is still normal pigmentation of your teeth. It's still okay. So when you're going to your teeth being now brown, that's when you have now fluorosis, okay? So the white and off-white is very, very common and normal. You'll find probably 9 out of 10 people have that off-white, and probably 1 or 2 have that really white natural. So when you find that extremely white, probably have cosmetic work done, which is okay. People want to have white teeth. If that's wellness for you, that's for you, But then when we are starting to move to brown now, and milky, chocolatey, white, brown, that means that we're having something called dental fluorosis. Yeah, so we can talk about dental fluorosis now.
Yeah, we can.
So dental fluorosis is becoming so common. It's becoming a menace now. This comes from consumption of water that has too much fluoride. Fluoride is found in minerals and rocks, and then seeps through the water. We dig a borehole, or we tap that water, we drink it, we consume it, we cook with it. Okay, then you end up getting fluorosis. You and I cannot get affected by high fluoride water now because we are past the first 8 years of life. So it affects people in their first 8 years of life. So the kids usually.
So even if I drink water that has a lot of fluoride, I
right now
not be affected right now.
Yeah.
Okay.
You get maybe you'll now start getting, for me, maybe the calculus more and more because of the too much fluoride, but it will not affect the color of your teeth or how strong your teeth are. So in the first 8 years of life, during development of your teeth, that's when all teeth develop, you find that when you have this too much intake of fluoride in water, your teeth get affected. So the outer layer is mineralized. That's the one that we call enamel. Okay. So when you take too much fluoride, during its development, it's affected. It doesn't harden as it should. So you find that these people with fluorosis, their teeth are weak. They chip off a bit. They pick up stains so easily, and they get cavities so easily. So now, how do you prevent fluorosis? One, if you're in an area that you know there is high fluoride, you live in Naivasha, you live in Nakuru, Lower Eastern, you can try to buy mineral water, okay? And then you take that, you consume that, and you also cook that, especially for your children.
How many can afford that?
Yeah.
You know, cooking with mineral water and drinking it all the time
exactly.
in the household, yeah?
Some people say you can boil, but it's not really effective, yeah? But also, I mean, this is where also the government comes in. If they know in places like Naivasha and Nakuru, there is high fluoride levels, they could put measures in place to defluoridate water, tap water that comes to people's houses. Because you see now, even if you get dental fluorosis, you're also exposed to something called skeletal fluorosis. Like your bones can also get affected from consuming water that has high fluoride. These apartments coming up around Nairobi, all of them, they're all digging boreholes to be able to sustain the population. So what do? Please defluoridate your water. There are so many people around who are selling defluoridating machines. You can get that done. There's institutions that you can take your water to get measured to see if it has too much, to test exactly, to see if it has too much fluoride or not. So you need to follow that up. And you also need to be aware that, especially the young people now, the millennials, the ones who are having kids now, 0 to 8 years, most of them are staying in apartments. So you need to make sure that the water you're giving your child has low fluoride levels. Yeah.
So there are people who, and you've seen this because you interact with patients a lot, having that brown or chocolate teeth can actually be very overwhelming, and some have even lost their self-esteem because of that, and even speaking in public becomes an issue. But I've seen developments taking place, like lately there's been a lot of talk about how it can be addressed.
Exactly.
Kitambo, that never used to be a discussion, but right now I hear there are actually options on how you can be able to help and treat it. So talk to us about that.
So you can imagine a young girl who's 12, 13, she's starting to become self-aware, and she's in school, she's being bullied because she has brown teeth. And how kids can be nasty. So that's why you should really take care of this and raise concern about it. So number one, awareness needs to be created a lot. Sometimes it comes from the government, the people, everyone. We need the dentists as well. We need to have, like in our organization, we need to push and tell people there's something called fluorosis. We also need to push the government to try and help people who live in such areas. People who live in urban centers, and if you are able, you need to also know that you can buy a defluoridating machine. You need to be aware of it. It's basically public health. We need to push and teach people about fluorosis, because a lot of people do not know. You find moms come into the clinic with their young children, 12, 13, and they're like, I don't know why this child has brown teeth. And they honestly have no idea what could have happened
where it came
about that. So it needs to be public. We need to just do better as a profession, raise awareness on it. work with the ministry, work with the government, try to push this properly so that people get to know about dental fluorosis, and so that we can try to avoid this. If you already have dental fluorosis, there are now ways to act on it. Again, as every other disease, there are levels to it. There is mild, there is moderate, there is severe. So there's different ways to work on dental fluorosis. It's irreversible. So what we do now is to mask the effects of the side effects, okay? So you go for things like veneers, crowns, to help mask that, because self-esteem is important. Also, again, these teeth get a lot of cavities. They easily break down. So you need to cap them by putting crowns on top, so to prevent that from happening and from you losing all your teeth. Yeah, so this is where now cosmetic comes in properly when you have cases of fluorosis.
Yeah. When it can't be reversed.
When it can't be reversed.
Yeah, when it's too much, yeah?
Yeah.
Funny thing, I've ever heard of a story of somebody who broke up with someone because somebody who is potential and they have all the qualities, but because they have brown teeth. So they were thinking this person will watoto wao watakuwa na brown teeth. Yeah? See how lack of information. But apparently you're saying it cannot be passed down. It's not a generational. It's actually caused by water that we consume. Yeah?
That we consume, yeah.
So assuming, what should somebody expect? And what is it that as doctors you consider before you make a decision to ung'oe meno ya mtu?
Okay.
So run us through from the process.
Yeah.
I've come and I'm in pain and I don't know where it's coming from, and I just need you to do something for the pain to go away. Yeah. So run me through the process of what to expect.
Yeah, I know you bring that because everyone, when they go to the dentist, they're usually like, I've not slept at all. That's not done. I'm done. I cannot have another night like this. That's not the solution to everything. So what you do, you see, a tooth is like a structure. Yeah. It's whole or not. So a cavity destroys the tooth. So the extent in which the tooth has been destroyed is what dictates how we are going to deal with that tooth. If it's too much, we call it gross caries, we'll have to remove. If like you've lost almost all your tooth structure, the crown structure, sometimes it's so impossible to save that. And at that point, we will have to remove it, okay? If the extent is mild to moderate, you've maybe lost a quarter of your tooth, half of your tooth, then we decide to do something like a filling, okay? Let me go take you back to a biology class. Outer layer of tooth is called, a tooth has layers, you remember? You did biology? Okay.
And don't ask me so many questions.
I will not. The outer layer is called enamel. The second layer is called dentin. And then we have the house of the tooth inside. The house of the tooth has the nerve, the blood vessels, called the pulp. Or also some people call it the root canal system of the tooth. Okay? So when you have a cavity in the outer, first or second layer, you do something called a normal filling, okay? So when it's coming to the house of the tooth now, the root canal, you have to do something called a root canal treatment, because now your nerves and vessels have already been infected. So you do root canal treatment, which takes 2 to 3 appointments. If the damage to this is too much, okay, past now the house of the tooth, you've lost too much tooth structure, then you need to lose that tooth. Okay, because there's no way to restore it. But removing a tooth should not always be the go-to solution, and that's what most people don't know. So when they have a very small cavity, they still want to remove the tooth. In the back old days, people used to do that. Now we do not recommend that. You'll even fight with your dentist about removing a tooth.
You want it removed? They tell you you don't have to remove it.
You don't have to remove it, yeah.
Long time ago it was. The dentist even wanting to remove it.
Exactly, yeah.
But they want to remove it.
Exactly, yeah. So now things have changed now. Yeah.
All right. Let's talk about the oral cancer. It's not very common, doesn't get talked much a lot, but it's actually a very big problem, yeah? Talk to us about how common it is and what are some of the, should I call them triggers or causes of oral cancer?
Oral cancer, yeah. So the first one is always, as I was telling you about, it's smoking.
But is it common? Like
it is common. Oral cancer is common. It's coming up. It's really common. You'll see it a lot in public hospitals and government hospitals. When they come to the dentist, they usually come with a sore in the mouth. So most oral cancers, the predisposing factor is smoking, alcohol intake, exposure to a lot of UV light, and especially in like maybe light-skinned people, people with something like albinism. So you'll find that you'll end up getting the UV light will activate some of the cells in your lips or in your mouth, and you end up getting oral cancer. The smoking and the alcohol reduces your immune system, attacks some cells that end up multiplying, and you end up getting cancer. Most of the time it starts as a sore or a wound, an ulcer, that's non-healing for over a period of time, over around past 14 days. If you get an ulcer, maybe you are stressed, someone is stressing you at home, your kids are stressing you, work is stressing you, or you hit yourself with a toothbrush, you'll get an ulcer. And it's usually so painful. You can't take anything salty. Yeah. But then in like 5 to 7 days, it goes away. Yeah. So that's okay. But if this ulcer does not go away past 14 days, 21 days, 1 month, you still have, that's usually the first sign of you need to get that checked out. Yeah, so you go to a dentist, a maxillofacial surgeon, they check, we run tests, we do maybe a biopsy to confirm that's not that. Yeah, but to reduce all this, because you see you get cancer of the lip, of the tongue, of the salivary glands, and yeah, they progress so fast. So it's good if you have an unhealing ulcer for over 14 days to have that checked out. Yeah.
All right. You call yourself a dental implant surgeon.
Yes.
So there's a lot that is being implanted these days. So we have talked about removing. Let's now talk about the reverse and the technology and the innovations that are currently coming up.
Okay. So now, when you lose teeth, you need to replace them. Because if you do not replace, worse things tend to happen, okay? So what happens is, when you lose a tooth, there are 2 ways of replacing teeth, okay? One is removable, which is like the one that you see people wearing. They're called dentures. You wear, you remove in the evening, you clean, you sleep, you wake up in the morning, you wear them. If you forget, shauri yako.
Na ukicheka sana in public, ianguke.
Exactly. Exactly, yeah. So those are called dentures. But a lot of people are really shying away from that. They want something called fixed. Okay, and there are different types of fixed. So the first one is called a crown and bridge. I can actually show you here. Good. That camera, there.
Yeah.
So you are missing a tooth in the middle here. So what you do is that you shave the tooth in front and the tooth at the back, and then they support that missing tooth like that. So that's called a crown and bridge. But this, we are discouraging it a lot because what we call biological cost, meaning that most of the times you have to cut a good tooth to be able to support a missing tooth. And anytime you touch a good tooth, you put a cavity on it, you put a filling on it, you put a crown on it, its chances of surviving for a long time go down. The prognosis usually reduces. So that's called a crown and bridge.
So this is not like a full tooth you replacing, yeah?
So now the one in the middle is the one that you're missing. Okay? So you're using the one before and the one in front of it to support the missing one. Also, you don't, yes, I know what you're asking. You don't put the root inside, so it's supported by the other two. So
and
you just
can detach this anytime.
So no, normally we cement.
Oh, you see, so it's permanent?
Yeah, it's fixed. Let's call it fixed. Yeah, it's fixed there because it can come out, but they rarely do. So that's called a crown and bridge. That's one of the options of replacing a missing tooth. The other option is now to reduce the biological cost, where you don't have to shave good teeth to support a missing tooth. You put something called a dental implant, and that's where the dental implant surgeon comes from. Okay. Yeah, so you put a titanium screw inside the jaw. It sounds like it's so painful, but it's actually very simple.
A screw on the gums.
Exactly. You see the same material that is used to do hip replacement, knee replacement, the material in the same line. Doesn't react with your bone, doesn't react, it's not electromagnetic, it will not ring when you pass through airport security. Yeah, so you put this titanium screw to act as the root analog. So it replaces your root, the one that we removed. And then you put the crown on top like that. So this is the gold standard of now replacing missing teeth, because this last is more durable. You do not touch the other teeth, and it's stronger compared to the rest. Yeah, so this is now the other way of replacing missing teeth. So either you do removable, the dentures, because not all patients as well can get implants done. So you do removable, the dentures, or you can do the crown and bridge, or now you can do the implant. But the implant, of course, is gold standard. It is the best way of replacing missing teeth.
So this is like the last resort. This is if your tooth or teeth have been removed. So this is the treatment that
would recommend
is like the option that you
yes,
have to replace them.
Missing teeth, yes.
The missing teeth.
Yes.
You're saying not all people can implant.
You can get implants, yeah exactly. So
why? Is it like a costly affair, or
no,
is it like
one, of course it's a bit costly.
Recommended, like consider there are factors to consider, or what?
This is specialized treatment again. You have to go back to school for it. And with the healthcare, the way it is everywhere in this country, specialized treatment is very hard to afford because it's very expensive. We don't have many people who are trained to do implants. We do not have many people who are trained to deal with cancers. So you find that because of this, it's a bit expensive. So most people cannot afford it. So they'll go for maybe the bridge, which is relatively cheaper. But also cheap is expensive.
Cheap is also relative.
Expensive, exactly. It's expensive and it's relative. And then other people still cannot afford the bridge, so they need to go for the denture. So now what the problem comes here, when you lose a tooth and you stay for a long time without using a tooth, your bone becomes wasted. You remember when you are sick and you stay in bed, or someone has been bedridden for a while, the muscles are wasted. They become because you are not using them. Same thing that happens in the jaw. If you note that area where the tooth was is not being used, it shrinks sometimes. It goes down as well, undergoes resorption, and you find that you cannot fit an implant there. Because again,
it takes long.
Yeah, it takes long. Yeah. Again, if you want to put an implant, there is a specific size, height, width that you need to put. You find some people are not candidates for that. If they're not, you can become a candidate for the bridge. If not, you go the denture option.
For the denture, do you measure? Do you come up with how the shape of my teeth is before you create it, or you just buy any?
So now they are.
Or you have to
they're like typodonts. They're like many of them. There are many of them. There are usually many of them. So what you do is that we match the shade of because you have a variety. Like you see the way the different type of foundation or something. Yeah. So you have so many of them. So what you do, we'll check you. We have a guide. We'll check this color of your teeth is trying to match the certain tooth size. They have codes. Then this is the shade, this is the shape, and then we say this is the one. So you try to come so close to what you have.
What you have.
What you have, yeah.
All right. Doctor, there are people who the teeth is all over the place. It's almost even coming out of the mouth. So what is the
Yeah, this is also very common.
Yeah.
It's called malalignment or crowding or malocclusion. So you find that either you have crowding where it's like you have too many teeth.
Yeah.
Okay, but in most cases you do not have too many teeth.
They look like there are too many.
They look like there are too many. What happened is they just didn't fit into the jaw properly because of a lot of factors. You find that you have a jaw size discrepancy where your teeth are either too big for your jaw or your jaw is too small for your teeth. So they do not end up fitting properly. Another common cause is that, you see the way kids lose their teeth, there is a sequence to it that should be followed. So you find that, because what happens, some parents anomona meno, itamea ingine. But maybe that tooth is supposed to come out when that child is 10 or 11. And then you remove it when the child is 6, 7 or 8. So what happens is that you get the first permanent teeth come out in front, and then the first permanent molar at the back. So they drill, and then in between you have the milk teeth that then you end up losing between 8 and 11 years. So you find that if you remove the ones in the middle, that first molar comes in front, and the premolars and the canines don't get space. So then you find you have crowding. You have a tooth growing up here. People call it homie. You see, you have growing up here, others are too crowded. So that's another cause, premature removal of milk teeth. That's another cause of crowding. Sometimes you have crowding because you have extra teeth. It's also common. Another form of malalignment is spacing. You can also have spacing because maybe now your jaw is big and your teeth are not as big as it should be. Yeah. So this is now called malalignment, and it's now treated using alignment. We call it alignment. There are different ways of aligning. A few years ago, it was just basically braces.
Braces, yeah.
Yeah, you just put the metal track lines and then you align it. So common among teenagers and very young adults. But now even adults are getting aligning your teeth. Remember, I was talking about wellness.
Yeah, people want to look good.
Everyone wants to look good.
You'll be surprised how much people are spending.
Exactly. It's the era of social media.
Look the way they want, yeah.
Everywhere you go, there are photos taken. And so you're cautious about how you look. Yeah. So even adults are now aligning their teeth.
All right. So
braces is one of the options of aligning your teeth. Another one, especially for adults and people who do not want to wear the track lens. So like you, yeah, you're a journalist and you don't want to come
with them. Though they've become quite common these days.
They've become so quite common. Yeah, they've become a thing.
People don't mind.
People don't mind, exactly. So we have something called aligners. Yeah. Okay? So, you know, a mouth guard, the people who do contact sports wear something in their mouth, yeah? It's the same concept, yeah? So you get a scan taken of your mouth, yeah? And then through AI and technology, we predict how your teeth are going to move, and we give you things called aligners that are going to move your teeth that you only have to wear, and they are totally clear. You can't even see them. You can't even tell someone.
They look like they are your teeth.
Exactly. It's like a plastic water cup, the way it's so clear. So you just wear it, and you have a couple of them sequenced to move your teeth over a period of time. So that's the new technology of aligning teeth. Yeah.
Thank you so much for creating time, Daktari, this morning. Of course, there's a lot that we still need to talk about when it comes to oral health, but I believe the much that we have handled is quite effective. I've been having this sit down with Dr. Naftali Macharia. He's a dental implant surgeon and a general practitioner. We appreciate your time and company. Final thoughts? Yeah. So please remember my rule of twos. Brush twice every day for at least 2 minutes and come see us twice a year. We are at the dental spa at the riverfront at Chiromo. And yeah, you can get our contacts online and you'll be able to find us there. Thank you so much. We appreciate your time and company, and of course also you for watching the questions you've shared with us. And I believe every Wednesday actually you're learning. It's a segment that just wants you to be a better human being out there, to be well, to be healthy. They say that health is wealth. My name is Safina Chengoma. Thank you for watching the show this Wednesday. That's how we wrap it up, but keep watching Citizen Television.